Well, Ghana joins the rest of the world to mark World Mental Health Day today. It's a day for global mental health education, awareness and advocacy against social stigma. This year, there's a special focus on suicide prevention. We'll have a discussion on this, but first, we want to bring back a story we told of a young lady who became pregnant on the streets of Accra and was abandoned by family and friends. Her story exposes the gaps in the mental health care delivery system in Ghana. Although the mental health bill was passed back in 2012, here are excerpts of that documentary produced by Nancy Emefa Tradosi.
Inside the Pantine Hospital are stories of people who have had different experiences in life, some of which have cost them the sanity of their thoughts. Rebecca was brought here by neighbors and some officials of the Adenta Municipal Assembly after she was found in labor somewhere on the streets of Adenta. Precious Afiadido is one of the neighbors.
First one of one of the then you may fall a moment if you could clap borders in the fake. Akayo, Ikaka, a food woman and 10 young men full doing. Anyaleko let time. Obey a full dugum, Benefami Jamie called Yamivako taxi. And you call you.
Rebecca does not seem to realize that she has been pregnant for 9 months. She obviously has not received any medical care throughout the full term of pregnancy. She was brought to the Pantine Hospital on the 15th of April 2019. She has given birth today. It's a boy. Rebecca thinks she is 63 years old.
Kadi.
Rebecca Adi.
Kadi.
Is spelling anything?
Kadi. K-A-D-I.
K-A-D-I. Now first name is Rebecca.
That's friends.
What do you feel saying?
She said they're 63 years.
63?
Yes.
Yeah, sure.
Yes.
Because who says 63? We are a strong woman. And I was 36. She should be breastfeeding by now. Her child is just 2 days old. But health workers here cannot take that risk of allowing Rebecca to hold her own son. According to the coordinator of the psychiatrist and clinical unit of Pantine Hospital, Dr. Levina Jima, this practice is not the best, but the current state of the mental health institutions is making it difficult to meet world standards.
In the ideal sense, in some countries like Australia and some advanced countries, they have a setup where they are able to accommodate mother and baby in the same place. So like a home. So mother is in a suite, baby has a cot. There's a caregiver for mother, there's a caregiver for baby. So as mother is getting treatment, their baby is with mother under supervision to ensure that we don't take baby away from mother, to ensure that there's bonding from the onset. So in the ideal sense, we should not. And sometimes it's heartbreaking to take baby away from mother just to ensure that baby is safe.
But just 24 hours after she was taken back into her ward, Rebecca managed to abscond.
They will live on your blind side or try to escape when you are not aware of their plans. But ideally, we don't want our services to be restricted like a prison. We want to be as friendly and as open as possible so that you are free to walk in and you are free to talk about wanting to go home. Sometimes we try to engage you to make you exercise patient and all, but sometimes you are not. Sometimes you are successful, other times you are not. But you don't want a situation where the individual will get hurt in the process.
This situation puts the nurses taking care of the baby in a state of fear. They spent the whole night guarding the baby in a different room. They feared Rebecca would come and attack them.
So at night, I have 3 night nurses on duty. At the point when one is going to rest, the nurse rests with the baby in the resting room. So that's how we've been keeping the baby from that day on. He's no longer left here because we are afraid the mother might come for him.
Ever since Rebecca became mentally challenged, the Adenta Municipal Assembly had been using part of its district assembly's common fund to cater for her. The director of Social Welfare Department of the municipality, Divine Ezogbe, got in touch with Rebecca's aunt to beg them to rescind their decision to give out the baby. According to the Mental Health Act 2012, care for mentally ill patients is supposed to be free, but as it stands, patients have to pay. Director for Pantan Hospital, Dr. Frank Benin, says this deters many families from bringing their relatives to receive care.
When you look at the law, mental health service is meant to be free. Okay, and we all know that there is nothing free on this earth. The days of manna raining down is long gone. So free means that somebody has to pay for it. Who has to pay for it? Okay. Currently, as it is, it's central government that has to pay for it. So there are 3 main psychiatric hospitals. Then we have the district units. The service should present a budget to government, and then as and when government deems it fit, it will give you something little. We've had years that we didn't get anything. I would say in the last 2 years it hasn't been bad. This year there were first quarter releases, we got something, but it's woefully inadequate. Because if I need about a budget of about 26 million, okay, to be able to run the hospital properly, and then all I get will be something less than $1 million for the whole year, then really, I mean, I'm seriously handicapped. Okay, so you know what you wish to do. You have a program for the year in place. Okay, and you know these are the things you need to do to be able to provide the good quality service that Ghanaians so deserve. But unfortunately, you are not being able to do it because what you need to be able to do it is not forthcoming.
The 3 hospitals providing mental health care across the country have over the years been surviving on the benevolence of philanthropists and suppliers. Government only releases funds to the various mental health institutions after threats are issued to release patients onto the streets.
If I use a appropriation bill, right, my real budget is something around 26 million. Okay, that is what I think if I'll be able to run the place properly and probably be able to provide the quality of service that we deserve. Okay. But quite often, you know what happens? They would ask you to develop a budget within a certain ceiling. Okay, and usually the ceiling is made up of what you can generate internally plus what government wants to give to you. So if I have told my Ministry of Finance that for this year I'll be able to raise, let's say, about 2.6 million, then they'll add the 130,000 that they want to give to me for the year to what I have projected to be my internally generated fund. Okay, so that is what it is. I'm hoping that this year I'll be able to raise about 3-point-something million. Yes, but even then, and I'm not proud to be saying this, I'm sort of breaking the law in the sense that we take money to be able to get the service to run, but the law says don't take money. But between you and I, as I sit here, if I stop taking money to get a service running today, the service will collapse. There will be no service for people to access. So that is the challenge. Okay, so yes, I'm generating some money, which I shouldn't be generating. But I'm being allowed to use that money, even though the law says I shouldn't generate any money.
But now Rebecca cannot access healthcare because the Adenta Municipal Assembly says it does not have enough funds to take care of Rebecca at the Accra Psychiatric Hospital. Ghana is among the signatories committed to realizing SDG 3, which seeks to promote mental health and well-being by 2030. But already, one major trend that continues to put Ghana in negative light is very evident. A tour across the major cities and towns in the country reveal a lot of mental patients, both young and old, on the streets. These persons, some of them stark naked, mostly drink from gutters and eat from refuse dumps. They often carry large luggage full of rubbish, but nobody seems to be concerned.
For me, not just me, okay, but leadership as well. Whenever I see it, I feel very guilty. I think we failed these people. I think all these talk about Ghana being a very religious country. There's something that along the way they were branding Ghana as very hospitable and all those things. It's a sham. Okay, if we are that responsible and hospitable, then we'll be taking care of these things. We won't wait for foreigners to come and then receive them nicely when our kids and kin are roaming the streets naked. And it's a shame. I mean, I think it should be a blot on our conscience. And my bigger worry is at the very top policymakers, because these are things you can change. This is the time for policymakers, the minister, to take to cabinet and say, no, these people roaming the streets, all they need is for us to say that, take care of them, and NHIS will pay. And it will be too expensive.
And this was first told about 2 months ago. Rebecca, who's at the center of the story, her condition has remained the same. The condition is essentially the same. Joining me to have a conversation, particularly on this day, is Peter Bedimakiyaro. He's Executive Director at Basic Needs Ghana. And Cecilia Fofo is a person who lived the experience of mental health. She also works with Basic Needs Ghana. Good morning to you too. Thank you for joining me.
Thank you very much. Thank you for the opportunity.
We're doing a lot of reflection whilst we brought back this documentary that you first watched when we first aired it. What's the state of our mental health today?
Well, thank you. I wish it were a pleasant one, and I'll say Happy World Mental Health Day, but I'm unable to say so because our situation remains virtually the same, and we are not doing much to improve mental health care in Ghana.
Why is it so?
Well, for various reasons. I think in our part of the world, the government is the largest giver of resources. They have the biggest purse of resources, having been entrusted with the resources of the states and all the powers that be on them to distribute the resources to places of need, have not seen mental health to be a place that needs support. And that has trickled down to families who have thought that they have spent all that they are able to do on an individual who has had a situation which has become chronic. They have probably spent all that they have been able to do, or they have even made a decision that with the limited resources we have, we aren't going to expense all of this on this individual who we are not sure of recovering. So the welfare responsibility that states should have as part of entrusting in them power, where you are not looking at profit, but the good of the community and the nation at large, should have stepped in and even put in place certain policies and conventions that ensure that anybody who has had a mental problem gets the needed support. Unfortunately, it hasn't happened. Yes, in 2012 we had a mental health act enacted by Parliament as a very progressive piece of legislation in sub-Saharan Africa, and we all applauded what Parliament, and for that matter the government, has done. And since government is in continuity, we were expecting that, having had the law passed, the implementation should have followed suit with proper resourcing, with proper awareness creation, and with all hands on deck. Unfortunately, we haven't had that. I can only say you, the media, are giving us this kind of platform, and we are hoping that it will reach government that they need to look at mental health.
Interesting. We hope every year, and then the situation continues to be the same. Cecilia, thank you for sharing. You have a personal experience because you've lived with a mental health condition. Can you tell us about it?
Yeah, I am personally experienced. That is, in 2016, I was diagnosed with acute psychosis, and I have struggled all along attaining health care and all that.
What's the symptoms of that acute psychosis? You said
you hear voices, and sometimes voices telling you to do things like to stab yourself, kill yourself, do this, run away from home, and what have you. So it's not easy struggling with that. But then in 2019, this year, my diagnosis changed, and I was diagnosed with bipolar affective disorder, of which I'm under medication.
Okay, what does that also mean?
That also is a mood swing. So when we talk about bipolar as a mood disorder, we have the manic episodes and we have the depressive episodes. So when it comes to the manic episode, that is when you feel you're on top of the world. You can do any other thing that you want to. But then when it comes to the depressive mood, then that is when you come crashing down. You feel the whole world is crashing down on you. You don't want to talk to anybody. You're depressed. You don't even want to take a shower sometimes. Yes, and some cases it's very serious. You think of taking your life, which is suicide, as we are talking about today. Yeah. So suicide as a matter is a huge thing. It's serious. It's a real. I have gone through that, and it's very real.
So this all started back in 2016. Do you know what triggered it?
I would think probably the death of my mother without me realizing it, because my mother died in 2007 when I was 12 years old. So I think it started from there, but I didn't really realize it, because while I was working and while in school, most of the time I can just go off, I can just lose balance and collapse, but I didn't really know what was going on until I was diagnosed. That is when I realized what was going on.
But what was the support? I mean, where was your first point of call? Was there anybody, any department or office that you could go to speak to someone?
Before, there was nothing like that, but everything changed. That is, my life transformed when I came into contact with Basic Needs Ghana. They have really done a marvelous job. As I would say that since 2001 in their establishments, they have been able to transform lives. That is 149,000 people, including their caregivers, their primary caregivers, and the people with the condition themselves, and still counting, which I am included. So they have been very supportive in terms of, but they can't do the job alone.
Absolutely
because
not.
In Ghana now, as at the estimation of 21.6 million people, we have about 650,000 people living with severe mental health cases, and then over 20,000 living with mild health cases. So you see the need is very great.
Absolutely.
That is why we are calling.
So Peter, you know, Cecilia mentions basic needs, and I'm wondering, so at what point did you get in touch with her? Who should have been who should have acted in your, because you stepped in because somebody or some system wasn't working? What was that?
Yeah, well, it's very humbling to listen to Cecilia share her experience, but I must also add that Cecilia's husband and close relatives have done quite a bit of yeoman's job, I should say. And if this is taken up by many families, we would have a lot more of Cecilia's living positively with their conditions. We cannot say that she will not suffer a relapse, but when that happens, we are all able to rally around. So Basic Needs came in contact with her at a situation of a relapse, and you can hear.
So when you say a relapse, kindly explain.
A relapse means that you have a condition that recurs occasionally. It can come at some point in time, and you feel ill, but that doesn't mean it will be with you forever. So there are times for a very long time you will not have the symptoms come to the fore.
And then suddenly
it comes back, and people can say, oh, the thing has come, oh, you see, so that kind of thing. So we came in when we met her in one of our community activities, and we have always worked with people with mental health conditions within their communities, encouraging families to come on board, encouraging communities to see their member of the community as one of them who needs their support. And through our self-help support groups that we have built around the communities, it was in such engagement that we came into contact with Cecilia, and Cecilia has made a remarkable transformation, and once again I thank her husband and her little child and the community, and we are hoping that if communities and individuals and families see Cecilia and many others, they would probably go back to the street and look for their relatives.
Okay.
Because those people on the street have families.
Yeah.
Even if they have come from wherever you call it, Burkina Faso or whatever, as people sometimes claim that, oh, these people are not Ghanaians. It's not true. They are Ghanaians. It's probably relocated from Tamale to Accra or from Bolga to Kumasi, but can be reunited with the family.
So Cecilia, let me ask about the importance of family support. You're fortunate. You have quite a number of people around you. What difference has that made?
It has made a big difference, because when I look at people, let me say, those on the streets, I feel very sad. I wish they could have the family that I have, because it has made a great difference. My husband, for instance, he makes sure that my medications are always intact so that I don't run out of medications. So it has made a very big difference. So as Mr. Peter is saying, if other families can also support their members in that way, it would have helped a long way. And probably if the conditions are being noted earlier, at the early stage,
because yours was not, you really didn't know, understand what was going on.
Exactly. So it takes, so I would advise that if you have somebody close to you, make sure you monitor their mood swings and their mood changes. If you think, no, this person is not going as a normal way they are going, try talking to them. Ask twice. Sometimes it takes you asking twice. You ask the first one, they might probably say, I'm fine, but in there, they are not. So ask twice and then listen to them. It helps a lot.
So how are you managing yourself today?
So with the help of medication that I'm under, I'm able to do a petty business, that is, I'm do soap and detergent selling, which basically supported me in that one. So I do that, and then probably when there are other programs concerning mental health, they do invite me.
So you're an advocate?
Advocate, exactly.
And because you've been there,
yes,
you are able to speak to the issues and talk to people who are also suffering with mental health.
Exactly.
Okay. Peter, how does it, Cecilia talked about a bit of the statistics, but how does it look in our country, considering we're not good with data?
We are not good with data, but the little that we have shows, once we're talking about suicide, and the Mental Health Authority have indicated up to 1,500 people committed suicide within the last 2 years. And that's probably 6 times the number, because this is what came to their attention. We ourselves in our community, through people talking and we taking an interest in issues of suicide, recorded 58 people who committed suicide in 2018 through various means, hanging by the rope or whatever, consumption of chemicals, poisonous chemicals, pesticides particularly, and a few using firearms or doing other things such as running into bodies of water and the rest. And it all shows it was precipitated by a mental condition. Normally, you would not want to harm yourself. So when you reach a point of saying, it's not worth taking my life, then you are not in the right frame of mind and need support. And that's why the World Mental Health Day is focusing on the 40 seconds of action. Talk to someone, and if you feel moody or feel a sense of loss or committing a certain act, you should try to talk to someone, because that is how you can come out of this suicidal ideation or feeling of harming yourself.
Okay, so this 40 seconds of action, we've got the video that the WHO put out. We want to share it with you now.
Great.
The teenage years can be full of excitement, opportunities, and newfound freedoms. Yet they can also be times fraught with worry about exams, relationships, and keeping up with peers and the latest trends. For some, this burden can become so overwhelming they take their own lives. Suicide is never the answer. There's always hope. If you're a school principal, put a plan in place for helping students and teachers to stay mentally healthy. Organise training for staff on what signs to look out for and how to have sensitive and compassionate conversations. Create a safe school environment where students and staff know they can seek help and talk to someone if they need to. A few words can make a world of difference.
They say a few words can make a world of difference. Cecilia, you would know this very well. In terms of the kind of action that they, they call for in this very short clip, how is that helpful in reality?
It helps a lot, especially in terms of talking to the person, the conversation manner. It helps a lot because when I visit the health facilities, they try to sit you down and talk to you and see how you're doing, how your family is doing.
When a person is feeling suicidal, what kind of conversation do you have with the person?
For instance, I would say when I was feeling suicidal, let me take myself as an example. When I was feeling suicidal, at that point in time, I didn't have anybody talking to me, anybody asking me what is going on. So at that point, without having anybody talking to me, the thoughts of being alone, left out, I'm worthless, I'm not needed, nobody loves me. So I felt like, then let me end it because nobody cares about me. You see, but if I had had a conversation at that point in time, I don't think I would have thought about those things to the highest peak of thinking about committing suicide.
How could somebody have figured out what you were going through?
That is why I mentioned earlier on that if you have a close person, especially family members, or if you're married, your husband or your spouse, they know you. So as soon as your mood changes, they can realize that, no, this is not you. Do you get it? So it comes with the mood swings. You know this person is like this. But then at a certain point in time, they became like, even with their words, they started saying something else. Then you realize there is something wrong in there. So it comes with a mood change most of the time.
So even with school children, and Peter, you can come in here because we've heard about incident of somebody either not making the grade, not getting a school of their choice, and it's not something that you think that a teenager would think of something like committing suicide because they haven't achieved something, because they feel that they have failed at something.
Yes, and that has come about because of the society that we live in. Of course, if you say about 2 or 3 decades ago, a young person in school going to secondary school who did not get his choice of school probably would not have contemplated suicide. But we have lived in an environment where we are so exposed to many things, from films, from storybooks, from what people say, where people think that I can try it, even without knowing what the consequences are likely to be. Perhaps this student thought that if I try suicide, I might survive. But unfortunately, it didn't. And it also comes back to the kind of pressure we put on ourselves, that people will now think, all right, so I haven't made it, what do I do? People will laugh at me, I don't feel useful enough, and all. So the pressure on us, the anxiety, the stress that people go through either to achieve or struggling to remain in relationships that are probably not that good, or which were thought to be safe and now have lost them, have all contributed to people contemplating that. And young people probably are taking a leaf from what goes in or goes around in society, and probably opt or see it as an alternative, sometimes not thinking that they can really lose their lives.
Also, sometimes people you're just doing it.
Yeah.
You haven't thought about the end yet.
The end yet. They haven't thought about the end yet. So again, thank you, Multimedia, once again for the documentary and the 40-second of action. We are continuing the conversation at the Asante Hall at the Swiss Spirit.
Well, I'll come to that. I just wanted to ask Cecilia about stigma, and then we'll come to what you're doing today. How have you dealt with stigma?
Well, I would say in Ghana right now, the stigma and discrimination is very high. And sometimes it is very appalling, because in my case, even my friends, whom I said I call my friends, stigmatized against me. Some of them were using words like "you're cursed." You see, so you see the level of stigma that is attributed. And sometimes the way people react and behave with you, you get it. They might not directly come to you, but you hear them talking behind your back. Oh, look at her, she's the one, she's gone rogue. You see, all those things, it's discouraging. So the stigma level is very high, and we trying, I must also say that I'm a part of a group called Time to Change Global. We are into helping reduce stigma and discrimination in Ghana now, because it's a challenge that we have. And what we do is that we go from places to places to educate people that if somebody has a mental health condition, that doesn't mean that is the end of their life, or they don't deserve to be part of society.
Absolutely.
They deserve to be part of society. With medication and therapy and all other things, they can contribute greatly and immensely to the society.
So let me ask you, where do you get that motivation from? How do you rejuvenate to encourage yourself so you can pass it on to others?
Well, most of the time I find joy in reading. I love reading and singing. So when I'm doing that, it helps me and motivates me that, hey, your little voice can help actually to change the lives of many other people. And it encourages me as well to always constantly take my medication, because if I'm okay, that is when I can inspire hope into others. If I'm not okay, I can't do that. So that gives me the power and the confidence to keep going and to keep doing it.
Great. Thank you. Peter, tell us what's happening at Alisa.
Yeah, as I said, we are continuing the conversation to highlight the issue of suicide and mental health in general in Ghana, and we are getting 3 experts in their fields sharing with us their perspectives on mental health generally. And we want everybody to be part of this conversation and encouraging as many people as can come to the hall to please spare that time today to have this conversation and to spread the word and get support personally and to others for being part of the conversation. It is part of reducing the stigma that we have just talked about, and very motivated personalities like Cecilia and the rest would be there to further share their own experiences. We are hoping that from this platform giving us, people would turn a leaf, and finally government would sit up. Because if we are talking about achieving universal health coverage, we are unlikely to attain the targets if we leave out mental health, because we cannot achieve complete health without mental health. And that's why government of Ghana, particularly Ministry of Health and Ministry of Finance and all those who matter in terms of resources and the right policies, need to really make this part of the agenda. Yes, people can come with their manifestos and the rest, but also look at the areas of neglect that you can bring in to make whatever your agenda to achieve as a government gets realized.
What time?
Leaving no one behind.
Yeah. What time is the conversation?
It's between 3:30 and 5.
Okay.
There will be a live version of it from 4 to 5 p.m. 1 hour to reach those who will not be able to come in person. And we would like to thank DFID, who have sponsored that program and our activities towards the World Mental Health Day throughout this week. They have been doing it over the years, and we are very grateful to them, and equally grateful to JoyNews for this platform.
And the 4 to 5 will be on Joy 99.7 FM.
Yes, please.
So if you're not able to make it to the hall, but we encourage you to, especially if you have either a family or you want to learn more about it personally, then you want to get in touch with persons like Cecilia, who can help you as well. Finally, before we close this conversation, is there an emergency? I know that the Mental Health Authority would usually put up an emergency number, but where is like the immediate go-to place if you think you have a mental condition or you're suffering from anything you want somebody to talk to? Where?
I would say first start from close relatives. Could be friends, could be classmates, could be anybody near you. I should say, unfortunately, and you have rightly mentioned it, we haven't got these helplines in Ghana as such. I know the Mental Health Authority of Ghana has put out some numbers to serve as helplines, and we hope that it continues throughout the country, because helplines go with having experts around 24 hours, and that has a resource implication, if for nothing, time. But we also need them across communities so that you know a go-to person. We're also thinking that counselors and our religious bodies that have pastors and Muslims and imams and sheikhs, where people really respect and agree to most of their pronouncements, can move a step further. A lot of them are doing that, but now serve as actually counselors and support, not just making religious pronouncements and predictions or prophecies, but being there for people who need a listening ear, like the Catholic Church, like the Methodists, our Christian Council, the Muslims, and the rest. They are commanding very high respect and should make available such expertise to people who need a listening ear. Mothers, fathers, let's listen to our young people who come with concerns rather than brushing them aside. Teachers should be more supportive of and observant of moods of their pupils and students, and be there, even if you're not a clinical psychologist, but be there to take the young person aside and ask, what is the problem? Can I help? Trust me, I can assure you of whatever you tell me in confidence. And these support systems can really work. For basic needs, we are also doing the self-help support groups, where in every community we encourage people who have had experiences of mental illness and primary caregivers who themselves have problems to come together within proximity of their communities to discuss issues, share with each other, laugh together, cry together, sing and dance together, but know that after all, you are not alone. Yeah.
All right, Cecilia, where, because you're going to say something.
Yeah, I also want to say, just as Mr. Peter said, you need to always have a trusted person, somebody you know that in case of anything you can go to, because we all can't say that we are on our own. Everybody needs somebody at certain points in time. So you need to have a trusted person, you know, this person I can go to when I'm in need of this or that, and that helps.
Well, thank you very much, Cecilia, for sharing your personal story with us. Thank you, Peter, for telling us, for sharing your thoughts and also about today's events as well.
Thank you very much for
and
the opportunity.
opening the doors, really. I really want to see parents and and people who serve in the mental health space to be there so that they can get more information.
Yeah.
I feel like you need to step back a bit, rejuvenate, get something so that you can arm yourself again before you face the world. So thank you for creating this platform.
Thank you.
Yeah.
We are very grateful to
Yeah.
you, we should say, for
Yeah.
this opportunity.
We want to end with a song. There's Hope by Aaron Crombie. Enjoy it when we come back. It's still a healthy Thursday, so we have lots of healthy conversations here on the AM show. Our breast cancer awareness conversation with the Nyaho Hospital is up next with Roland Walker.